As a pregnant positive, HIV positive mother, it is possible, and it has been proven and it has been shown that you can have a child that is not HIV infected. And what you need to do to ensure that is that, first and foremost, immediately you find out that you're pregnant, any pregnant mother, for that matter, needs to attend what we call antenatal care services. So you need to present yourself to a health facility, whether public or private, and these services are offered even at the lowest level, dispensary level, health center level, and even in the clinics that we have, the private clinics that we have. So you need to present yourself at a health facility for your antenatal care profile to be taken, and part of that profile is that the healthcare worker is going to offer you an HIV test, and it is good for you to accept the test so that you can get to know your status. If you're HIV negative, you would still receive information around how to maintain a healthy pregnancy. And an additional component that we're adding is testing for syphilis. You will be offered a test for HIV and you'll be offered a test for syphilis. Syphilis, again, is something that we need to pick because it puts you at risk of acquiring HIV. But beyond that, it also predisposes you to poor health outcomes for your unborn child. So you will be offered a test for HIV and syphilis. Should they turn positive, then the healthcare worker is going to manage you appropriately. So back to the subject of preventing transmission to your unborn child should you be positive. If you're found positive, you're going to be prescribed antiretroviral medicines that you'll be taking for your own health, but also to reduce the amount of virus in your blood. And when the amount of virus in your blood is reduced, then the chances that you'll transmit it to your baby is minimal. So you need to take these medicines every day. Some of them are daily. In fact, what we recommend for the pregnant women is a daily pill. So you swallow it every day at a prescribed time consistently throughout your pregnancy, and continue to attend your ANC visits so that the healthcare worker can continue checking that you're progressing well, both you, your health, and your baby's health. You're encouraged also to give birth in the hospital. I know that most of us, there are some mothers who prefer to give birth away from the health facility because, again, the risk of transmitting, even though you're on treatment that is reducing the amount of virus in your blood, is low. At birth, because it's a very invasive process, there's a risk that you could transmit. So it is advised that you deliver in a health facility. That's what we call skilled delivery, and not to deliver at home. That is the second point for which you can ensure that the child that you will bear is not HIV positive. When the child is born, again, there's medication that we give to the child. We call it prophylaxis. It is ARV medication that the child will take for as long as they continue to breastfeed. I think, in summary, those are the components that you need to undertake if you're a positive pregnant mother. Take your ARVs religiously. Make sure you deliver in a health facility. Once the child is born, make sure that you give the ARV prophylaxis. The fourth component is the testing. The child is supposed to be tested at 6 weeks, what we call an early infant diagnosis. Again, when you present the child for the first immunization schedule, make sure that when the EID test is offered, make sure that you bring the child at 6 weeks for that testing to be done. And there are other scheduled tests at 6 weeks and subsequently until 18 months, upon which the child would be confirmed that they are HIV negative.